Hi, everyone. Welcome to Nurse Ally, where I'm here to be your trusted ally in health and wellness. I'm Gabe, a clinical nurse specialist, and my mission is to make healthcare easier to understand and more accessible for everyone. Whether you're a patient, a family member, a healthcare student, or someone just curious about staying healthy, you're in the right place. On this channel, we will dive into key health topics, give practical tips, and cover things you can do to take control of your health. So if you're ready to learn, stay informed, and keep yourself or your loved ones safe, make sure to subscribe and turn on notifications. Let's take the journey to better health together. I'm so glad you're here because today's topic could make a life saving difference for you or someone you love. We're talking about sepsis, a medical emergency that many people don't understand until it's too late. Sepsis. Perhaps you've heard of it. It is often associated with infection or germs. It can be hard to spot. It's also not too common for most people. Sepsis is your body's overwhelming and life threatening reaction to an infection. This occurs when an infection triggers a widespread inflammatory response throughout your body. If not identified or treated right away, it can lead to tissue damage, organ failure, or death. But don't worry, we're here to empower you with the knowledge you need to recognize the signs and take action fast. I want to introduce these little critters to the right here that are responsible for causing infections. Let's call them germs. These germs include the virus, the bacteria, the fungi, the protozoa, and the parasite. Although microscopic in nature, these germs can potentially cause big issues to your health. Normally, our body has the awesome capability of protecting us from these foreign invaders when they attempt to enter our body. However, sometimes these germs end up overtaking our natural barriers and overload the body, causing a chain reaction of issues leading to a very sick person. To better understand these emergent conditions, let's go over these simple analogies. I want you to imagine your immune system as an army trained to defend you from invaders, like bacteria or viruses. Normally, this army attacks only the infection itself, but in the case of sepsis, that army goes rogue. It launches an all out assault, causing massive inflammation throughout your body. This widespread inflammation can damage your organs and tissues, making the situation far more dangerous than the original infection. It's like a small kitchen fire turning into a house-wide inferno, damaging things throughout the house. Sepsis can be caused by a range of infections that, if left untreated, can trigger a severe response in the body. Here are some common causes to help you gain insights to this condition. Pneumonia, an infection in the lungs that can spread to the bloodstream, leading to sepsis. High-risk groups include older adults and those with chronic lung conditions. Urinary tract infections, or short for UTIs. These can escalate to sepsis, especially in older adults or those with catheters. Urosepsis occurs when the infection spreads to the kidneys or blood. Infections like appendicitis or those from a perforated intestine can lead to sepsis. Surgery or conditions like pancreatitis can increase this risk. Conditions such as cellulitis, abscesses, or infected wounds can progress to sepsis if bacteria enter the bloodstream. Burns and large wounds often pose a higher risk. Bloodstream infections, and those are infections directly in the blood, often from IV lines or central catheters, that can also lead to sepsis, and these are common in hospital settings. Healthcare associated infections, those are infections like surgical site infections, ventilator associated pneumonia, or catheter related UTIs that can lead to sepsis, particularly in hospitals or ICUs. People with weakened immune systems, such as those with cancer, HIV, or organ transplants, are more at risk for infections that can progress to sepsis. Bacterial infections from contaminated food or water, like Salmonella or E. coli, can spread and lead to sepsis as well, especially in vulnerable populations. Infections of the brain or spinal cord, such as meningitis, can lead to sepsis, particularly in young children or those with weak immune systems. So, understanding these common causes is key to early prevention and treatment, ensuring infections do not progress to life threatening sepsis. Signs and symptoms are ways the body indicates to us that there is an injury, illness, or disease. So, let's talk about signs for a little bit. Those are objective evidence of a disease that can be seen or measured by someone else, such as fever, bleeding, skin rash, or lumps. On the other hand, symptoms, those are subjective evidence of a disease that is felt or noticed by the person who has it, such as pain, fatigue, headache, or other pains in the body. The signs and symptoms of sepsis can vary widely, but recognizing them early is crucial, as sepsis can escalate very rapidly. Here's an expanded overview of common indicators. A high fever is a common initial response as the body tries to fight off infection. In some cases, especially in older adults, sepsis can cause a dangerously low body temperature. When the heart rate rises above 90 beats per minute, it's often the body's way of delivering more oxygen to tissues. An elevated heart rate suggests systemic stress and potential infection spread. A respiratory rate of more than 20 breaths per minute is the body's way to maintain blood oxygen levels. Tachypnea is a critical early sign, especially alongside other symptoms. Confusion, disorientation, or difficulty staying awake can mean sepsis is affecting the brain, often due to reduced oxygen flow or toxin buildup. A drop in blood pressure may indicate that sepsis is progressing to septic shock, impacting organ function. It can cause dizziness and cold extremities due to poor circulation. Reduced urine output suggests kidney involvement, as they're not receiving enough blood flow to filter waste effectively. Monitoring urine output is key for identifying organ dysfunction, but it's important to note that decreased urine output alone does not signify you have sepsis. But if you experience these other symptoms along with a change in urine output, could further strengthen the diagnosis of sepsis. Chills or shivering reflect the body's response to fight infection by raising its temperature. That's a notable sign when combined with other symptoms. Skin may also feel cool and clammy as blood flow diverts to vital organs. Poor blood flow can cause pallor or mottling in extremities, indicating circulation issues. Severe exhaustion is common as energy is directed to fighting infection. This fatigue often feels disproportionate to typical illnesses. Gastrointestinal symptoms increase dehydration risk, complicating the body's response to sepsis. Blood tests showing a high white blood cell count signal infection, while a low count may indicate immune system strain. Both abnormalities are key for diagnosing systemic infection. High risk populations for sepsis include groups that are more vulnerable to developing severe infections and subsequent complications due to various health and age related factors. Understanding these populations is crucial for early detection and prevention efforts. The immune system naturally weakens with age, making older adults more susceptible to infections that can escalate into sepsis. Newborns and young children have immature immune systems that are not fully capable of fighting off infections effectively. Conditions like pneumonia, bloodstream infections, and meningitis are common triggers for sepsis in this age group. Premature infants and those with congenital conditions are at an even higher risk due to underdeveloped organs and immune systems. Individuals with chronic conditions such as diabetes, kidney disease, liver cirrhosis, and cancer have a heightened risk of developing sepsis due to a weakened or compromised immune system. Treatments like chemotherapy or immunosuppressive medications can reduce the body's natural defense mechanisms, making it harder to control infections. Those with compromised immune systems, including people living with HIV, AIDS, organ transplant recipients, and patients on long-term corticosteroids or other immunosuppressive therapies, they face a greater risk of infections that can lead to sepsis. Their reduced immune response makes it difficult for their bodies to mount a defense against even minor infections. Hospitalized patients, especially those in ICUs, are at higher risk due to the presence of invasive procedures like central lines, urinary catheters, and mechanical ventilation. These devices can be entry points for bacteria and other pathogens. Surgical wounds or open injuries can also serve as sources of infection, increasing the likelihood of sepsis. Those recovering from severe illnesses or major surgeries are vulnerable to sepsis as their bodies may already be weakened and their immune systems may be compromised. Post-operative infections can quickly escalate to sepsis if not monitored and treated promptly. Sepsis is a serious health problem that affects millions of people worldwide each year and is responsible for about 20% of all deaths globally. Here are some of many key facts I wanted to share with you so you can understand the impact sepsis has on our community's health. Each year, at least 1.7 million adults in the US contract sepsis. Sepsis has also moved its way to the top of leading causes of death for US hospitals, costing organizations millions of dollars per year. I wanted to highlight that most sepsis cases begin pre-hospital, which is important for you viewers out there as you can identify sepsis before it gets out of control. We are going to dig a little deeper into how these germs can cause sepsis, severe sepsis, and the worst form of sepsis called septic shock. This flowchart guides you to the different stages of infection. By expanding on this flowchart, it will help you illustrate the typical stages and actions that should be taken at each stage. This will help you manage it effectively. So let us go step by step. Let's first talk about what happens during the initial infection phase. The initial stage of an infection begins when these germs or pathogens enter the body and start multiplying. This can occur through various means, such as through a break in the skin, inhalation of contaminated air, or ingestion of contaminated food or water. Those are examples of the common causes we spoke of earlier. The body's immune system typically responds by sending white blood cells to the site of infection, resulting in what we call localized inflammation. This is where you normally see redness, warmth, swelling, and pain. During this stage, individuals might experience a low-grade fever, fatigue, or mild discomfort, but these symptoms can often be mistaken for less serious issues. Early recognition and intervention are key here. Cleaning and covering external wounds, staying hydrated, and monitoring for changes in symptoms are essential steps in managing the infections and preventing it from spreading or worsening. If signs of infection persist or progress, medical attention should be sought to prevent potential complications. Next stage is working alongside the infection phase discussed previously. This is the body's immune response to an infection. The body's immune response to an infection is a complex, multi-layered defense system designed to identify and eliminate harmful germs. When an infection begins, there is the first line of defense called the innate immune system. It responds rapidly to the invading germs. There are white blood cells, such as macrophages and neutrophils, that go to the site of infection, where they work to engulf and destroy these germs or pathogens. This initial response triggers the release of signaling molecules known as cytokines, which promote inflammation. The inflammation results in redness, warmth, swelling, and pain, which are classic signs of the body's effort to isolate and fight the infection. Simultaneously, the adaptive immune system may also be activated if the infection persists. This involves specialized cells like T cells and B cells that can specifically recognize and remember germs for a more targeted attack. This coordinated immune response aims to eliminate the infection, prevent its spread, and facilitate tissue repair. However, if the immune response becomes too aggressive or unregulated, it can lead to widespread inflammation, potentially causing sepsis, which is a severe, life threatening reaction. The severe infection stage represents a critical escalation in the body's response to an invading pathogen, where the infection starts to impact systemic functions. During this phase, the infection has overwhelmed local defenses and begins to spread, potentially affecting multiple organ systems. This inflammatory state is called systemic inflammatory response syndrome, or short for SIRS. The SIRS criteria is used to help identify when the body is showing signs of widespread reaction to an infection. For the public, it's important to know that these signs mean the body is fighting hard and may need medical attention. To meet these SIRS criteria, there must be two of the following: high fever or hypothermia. The following temperatures are noted in the slide in both Fahrenheit and Celsius. Temperature plays a crucial role in monitoring sepsis because a significant change in body temperature, either a high fever or low temperature, which is known as hypothermia, can be a key indicator of the severity of the infection and is often associated with poor prognosis, making it a vital sign to track when managing sepsis patients. While a fever can be a normal immune response to fight infection, a low temperature can signify a failing body unable to maintain its normal temperature regulation due to the systemic inflammatory response. An elevated heart rate in the context of SIRS is a sign that the body is under stress and working harder to respond to an infection or inflammatory process. When the heart rate exceeds 90 beats per minute, it indicates that the body is trying to increase blood flow to deliver more oxygen and nutrients to tissues to fight the infection and remove waste products. This elevated heart rate is part of the body's natural response to manage and contain the infection. However, it can also suggest that the infection or inflammation is significant enough to affect the body systemically, potentially leading to more severe conditions like sepsis if not managed promptly. Chills and fatigue are signals that the body is mounting an intense immune response to an infection or inflammation. Chills often occur when the body is raising its internal temperature to create a less favorable environment for pathogens, indicating that the body is fighting an underlying issue. They can accompany fever and show that the body is trying to enhance immune function. Fatigue reflects the significant energy demand the body is facing while activating its defense mechanisms. The immune system requires substantial energy to deploy WBCs, produce inflammatory mediators, and increase metabolic processes to combat the infection. When fatigue and chills are present, it suggests that the body is in a heightened state of alert. And while these responses are meant to help control the infection, they also signal that medical evaluation might be necessary to prevent escalation to sepsis or septic shock. Breathing rate increases as a body's way of meeting the higher oxygen demands triggered by the immune response and metabolic changes during the infection. This increased rate helps expel carbon dioxide more rapidly, which is a byproduct of heightened cellular activity during immune response. Carbon dioxide levels being low in the blood signal that the body is attempting to correct an acid base imbalance, often due to lactic acid accumulation from cellular metabolism under stress. When the body senses rising acidity, it increases the breathing rate to reduce carbon dioxide and help maintain a balanced pH. This reaction is a compensatory mechanism that reflects the body's efforts to manage systemic stress and fight infection. If both increases breathing rate and low CO2 levels are present, it points to a significant physiological response and indicates that the body is under systemic stress, potentially progressing towards sepsis. Recognizing these changes early can guide you in a timely medical intervention to prevent further complications. As we discussed earlier, white blood cells are the main components of the immune system. A WBC count is often part of a complete blood count, or CBC, which is a common test that can help diagnose and monitor a variety of health conditions. A WBC count can help diagnose conditions such as infections, inflammation, and blood cancers. An elevated WBC count suggests that the body is actively fighting an infection or dealing with significant inflammation. A low WBC count may indicate that the body's immune system is overwhelmed or suppressed. This can happen in severe infections where the body cannot produce enough white blood cells to keep up with the demand or due to conditions that suppress the immune response. So, to summarize, during SIRS, the body's inflammatory responses become more pronounced, releasing large amounts of cytokines and other inflammatory mediators that, while meant to fight the infection, may cause collateral damage to the body's own tissues. This can lead to organ dysfunction, evidenced by symptoms such as decreased urine output, altered mental status, and difficulty breathing. And if not treated promptly with aggressive medical interventions such as intravenous antibiotics and supportive measures like fluid resuscitation, a severe infection can progress to sepsis or septic shock, posing a significant risk to life. It is why early recognition and intervention are essential to manage this stage effectively and prevent further complications. The sepsis stage occurs when there is clear evidence of a systemic response to infection, meeting SIRS criteria alongside confirmed or strongly suspected infection. As mentioned previously, the SIRS criteria are crucial in identifying the early stages of sepsis, as they highlight the body's broad immune reaction. For sepsis to be confirmed, the patient must show signs of SIRS, such as abnormal temperature, increased heart rate, rapid breathing, or abnormal white blood cell counts, combined with clinical signs of infection and early organ dysfunction. So, in this stage, the body's immune response to the infection has become excessive, leading to a cascade of inflammatory signals that impact organ systems. This is why SIRS criteria is so important because it helps the individual identify when an infection is progressing beyond local containment to a systemic threat, signaling severe sepsis when coupled with clinical signs like altered mental status, the decreased urine output, or low blood pressure. Sepsis requires immediate medical intervention, such as broad spectrum antibiotics, intravenous fluids, and sometimes vasopressors to stabilize blood pressure. Monitoring organ dysfunction closely is essential to catch and mitigate further deterioration. The timely recognition of confirmed sepsis using SIRS criteria enables healthcare providers to act swiftly, reducing the risk of severe sepsis or septic shock and improving patient outcomes. The severe sepsis stage represents a critical point in the sepsis continuum, where the body's response to infection progresses beyond initial inflammatory reactions and starts causing significant organ dysfunction. This stage is more severe than basic sepsis, indicating that the body's compensatory mechanisms are failing and the immune response has become dysregulated. In severe sepsis, the extensive release of inflammatory mediators leads to a widespread damage that can impair organs such as the kidneys, liver, lungs, or brain. Patients may exhibit symptoms like difficulty breathing, confusion or altered mental status, decreased urine output, and severe hypotension. Laboratory findings may show elevated lactate levels and signs of organ damage, such as abnormal liver enzymes or impaired kidney function. In the sepsis continuum, severe sepsis is the phase where the infection is no longer localized or manageable with basic treatment. It indicates that systemic infection has led to substantial physiological changes, pushing the body towards critical dysfunction. This stage acts as a threshold, emphasizing the urgency of advanced medical interventions. Treatment typically involves aggressive fluid resuscitation to manage hypotension, administration of targeted antibiotics, and possibly vasopressors if blood pressure does not respond to fluids alone. Supportive measures such as mechanical ventilation or dialysis may be required if organ failure progresses. Recognizing severe sepsis is crucial as it serves as a precursor to septic shock, where circulatory and metabolic abnormalities result in life threatening low blood pressure unresponsive to standard treatment. Early recognition and aggressive treatment at the severe sepsis stage can prevent progression to septic shock and improve survival outcomes. The septic shock stage represents the most critical and life threatening phase in the sepsis continuum. It is characterized by severe circulatory, cellular, and metabolic abnormalities that lead to profound and persistent hypotension, which is unresponsive to initial fluid resuscitation efforts. Septic shock occurs when the body's response to an infection causes extreme inflammation and a widespread release of cytokines and other inflammatory mediators, leading to blood vessel dilation and leakage. This causes a significant drop in blood pressure, impairs blood flow to organs, and disrupts cellular metabolism. The result is inadequate oxygen delivery and nutrient distribution, causing tissue hypoxia and further organ dysfunction. In relation to the sepsis continuum, septic shock is the progression from severe sepsis, indicating that the body's defense mechanisms have been overwhelmed. Patients at this stage often exhibit symptoms such as dangerously low blood pressure, confusion or loss of consciousness, rapid and shallow breathing, cool and mottled skinned, and decreased urine output. Laboratory findings may include elevated lactate levels and evidence of multiple organ dysfunctions, such as acute kidney injury or liver impairment. Management of septic shock requires immediate and aggressive interventions. This typically includes the administration of high dose vasopressors to maintain adequate blood pressure, continuous fluid resuscitation, and broad spectrum antibiotics to control the infection. Advanced supportive therapies such as mechanical ventilation or renal replacement therapy may be needed for patients experiencing respiratory or renal failure. Early and prompt recognition of septic shock in the sepsis continuum is crucial as it significantly impacts the chances of survival. Rapid intervention with a comprehensive treatment approach can help stabilize the patient, prevent further organ damage, and improve outcomes. We won't go over all these different tests and treatments at this time since it first requires a basic understanding of sepsis. We will save these for another video where we will go more in depth on sepsis management from the healthcare provider perspective. While managing sepsis at home is not generally recommended due to the need for urgent medical intervention, there are strategies to manage infections at home and prevent them from escalating into sepsis. Early intervention and careful monitoring of infection symptoms are key to stopping the progression. So let's talk about early recognition of infection. One good strategy you can incorporate to your health practice is to recognize the signs of infection early, such as fever, chills, swelling, and redness. This helps you monitor symptoms that might suggest worsening, including persistent fever, fatigue, or new pain. Monitor vital signs is also an effective strategy. If there are signs of infection, checking temperature, heart rate, and breathing rate regularly is important. High fever, rapid heart rate, and fast breathing are warning signs of infection spreading. Number two, prompt treatment of minor infections helps prevent further infection. So there's a few strategies you can do here. One is wound care. So keeping wounds clean and covered, applying antiseptic or antibiotic ointments as needed, change bandages regularly, and look for signs of worsening infection like redness or swelling or signs of pus formation. Oral hydration is another good strategy. So encourage staying well hydrated as dehydration can worsen infection response. Fluids help maintain blood pressure and support immunity. And lastly, pain and fever management. So using over-the-counter medications like acetaminophen or Tylenol or ibuprofen to control fever and pain, which can improve comfort and prevent dehydration. Number three, know when to seek medical help. So recognize early signs of sepsis is very important here. Key signs that an infection may be progressing towards sepsis include confusion, extreme fatigue, rapid breathing, low blood pressure, and decreased urine output. So seek emergency care immediately if these symptoms appear. Prompt communication. Stay in contact with healthcare providers if symptoms do not improve or new symptoms appear. Timely Consultations can provide guidance on whether to seek hospital care. Number four, preventing infection escalation. So, using antibiotics as prescribed. Um, Here, you want to ensure antibiotics are taken exactly as directed, even if symptoms improve. Stopping early can cause the infection to rebound. Support immune health. So, here, you want to encourage a balanced diet, you want to rest, and low stress levels to maintain immunity. Supplements like vitamin C or zinc may support immunity when recommended by a healthcare provider. Number five, managing chronic health conditions. So, control chronic illnesses. Here's very important. You want to keep chronic conditions like diabetes or heart disease well managed to reduce infection and sepsis risk. This includes following medication schedules and monitoring vital signs. Avoid exposure to contagions. So, for individuals with weakened immunity, avoid contact with sick individuals and practice good hygiene to reduce infection risk. Number six, monitoring for warning signs post hospital discharge. So, follow your discharge instructions carefully. Here is important for those recovering from hospitalization, especially for sepsis. Follow that discharge instructions is very essential. Attend follow ups and complete medication courses, and monitor for any return of symptoms. Watch for recurring symptoms as well. Patients who have had sepsis are at higher risk for reinfection, so monitor for recurring symptoms, even if mild, and contact healthcare providers if there's concern. Hand washing is one of the simplest yet most effective ways to prevent infection. By washing your hands regularly with soap and water for at least 15 seconds, you remove germs that can cause illnesses, including those that lead to sepsis. The goal is to focus on scrubbing all areas, especially between your fingers and under your nails, where germs often hide. Hand washing is especially important before eating, after using the restroom, and after contact with public surfaces. By making hand hygiene a habit, you protect not only yourself but also help reduce the spread of infection to others. Vaccinations play a crucial role in preventing infections that can lead to sepsis, offering significant protective benefits. Vaccines work by imitating an infection to engage the body's natural defenses. Vaccines help the body learn how to defend itself from disease without the dangers of a full blown infection. So, by receiving vaccinations such as those for influenza, pneumonia, and COVID 19, you reduce the likelihood of developing severe infections that may progress to sepsis, particularly in high risk individuals like the elderly or those with weakened immune systems. In a broader sense, vaccines help lower the community wide incidence of certain infectious diseases, creating a protective buffer that reduces the overall chance of infections spreading and progressing to serious complications like sepsis. Staying up to date on recommended vaccines is a proactive measure that strengthens individual and public health, making it a key component in sepsis prevention strategies. Remember, small actions can make a big difference. By practicing good hygiene, staying informed, and acting quickly, you're actively helping to prevent sepsis. Every step you take toward prevention is a step toward a healthier future for you and your loved ones. Together, we can create a healthier community by spreading awareness about sepsis prevention. So, thank you for being proactive and learning about these essential steps. Help us spread the word about sepsis prevention. Share this video with family and friends so they too can take steps to protect themselves. Let's build a community of informed, empowered individuals working together for health. Stay empowered and remember, you're not just learning, you're making a real difference. I want to leave you with this quote to inspire you in continuing with your healthcare knowledge journey. Prevention starts with knowledge, but it grows with action. So if you found this video helpful, don't forget to like, subscribe, and share with others. Join me next time on Nurse Ally as we continue to explore health topics to help you stay informed, healthy, and ready. Until then, take care and be well.